Here we are. We're still vibing at ViVE 2024 in Los Angeles, and today we're joined by Peter Jongwe, and I am Dave Pavlik.
And I am Ellen Brown, two of our three co-hosts for the Reverse Mullet Healthcare podcast. And we're really excited to have Peter on. So I have to, well, first of all, introduce yourself and tell us about because we're very smitten with Peter's company. So we're really glad that he was able to come and talk to us today.
Awesome. Thank you all for having me. Peter Jongwe, founder and CEO of Oben Health. And what we're doing is we're bringing care to where people are. So we are building the tech infrastructure to deliver care in trusted community spaces, starting with barbershops and salons. And when I met Ellen and she invited me to be a part of this, I was honored and just really excited for this conversation.
So I have to tell you,
it's such a cool concept.
It is such a cool concept. And so you are the epitome to me of why this podcast has really reinvigorated me, is that there's so many good things happening in healthcare that are genuine, that are for the right reasons, that aren't. Anyways, I will stop there and just say, and I just love having a platform to bring a voice to those things. And that's why we wanted to do this podcast. So it's like very meaningful to me when things that aren't necessarily mainstream understood, not that we're some mainstream like thing, but we do have a lot of folks that listen, and I just feel like if you can put the word out there. But I did have something kind of exciting, I thought, for you. So yesterday afternoon, I went to a panel that was about retired sports stars and venture. And so there were two retired NBA folks. Well, it was Magic Johnson's foundation, and they have a venture fund. And then there was another one, BIG is another fund that was there, and then two kind of more typical VC people. But I talked to Stefanetta Bingley. I don't know if you've heard this name. So she's one of the heads of Magic Johnson's fund, and she said what we're really focused on is finding things, new innovative things that serve the inner city community, and we want to invest in those. And so I told her about your company, and she wants to meet you. Like, she wants me to connect you.
Oh, wow. That's exciting.
So there you go. So I had to tell you. I was like, I'm going to tell him whenever we're together, because it was just yesterday afternoon. So
goodness.
Yeah, because I told her, I said, I'm not involved in this at all, but I met Peter and I love what he does. And I think this is so smack dab in the middle of what you're talking about. And I was like, so it may not be, it may be. She's like, no, totally. Like, and she gave me her card, and I'm going to connect you.
Oh, wow. Oh,
yeah.
Amazing. Thanks, Ellen.
Yeah. So anyways, so there you go. So see, good things happen when you meet at a loud bar at JP Morgan, and both of us were like painfully.
Everyone knows the story. Ellen, I was actually talking to someone else, and Ellen was like, I think what was going on again? Because
I was sitting,
eavesdropping.
I was eavesdropping because I don't like loud bars. And JP Morgan, like half the events I went to were like really nice and quiet and subdued, and then the other ones were just these like loud. It was like being in college again, and I had a great college experience, but I'm done. And so we were at
I think probably you overheard him say something. You went, wait, hey.
No. But so I was sitting along the wall. I was hungry. I was so hungry. And there were these tofu sticks.
Oh my God.
And I was like, I'm just going to sit and eat tofu sticks by myself. I was just doing that. And then I'm like listening. And Peter's talking to this person. I'm like, this is like the coolest thing ever. Yeah. And I let them talk. And then finally, I was like, excuse me. I was like, I don't want to interrupt your conversation for good, but can we connect offline? Because I love what you're saying you're doing, and I want to know more about it. And so there we are. So.
Well, want to tell us a little bit more about the model?
Yeah. So what we do is we train the barbers to be community health workers. And really, it's not just, people are going to think just barbers, but it's more of these people that people trust, where people go to, where they feel like there's a sense of belonging. So we train them as community health workers. They're entry points to screen patients. Right now, we're focusing on hypertension. So once the screen patients, if they meet the threshold that we're looking for, they're enrolled into the program. And then that's where it kind of starts cascading, right? So then they're scheduled to meet with a care provider in the barbershop or in that trusted community space Because one of the things you don't want to do is just refer someone, because that's great. I call that version 1.0, where you're like, all right, great. There's all these community initiatives. It's like, yeah, we're going to meet you where you are. We're going to refer you to a PCP or to a specialty care. But people fall along the way, right? They got to think about transportation needs. I got to think of time of work. That simply doesn't work, right? It works to a certain extent. So it's like, how do you close that gap? And it's essentially by meeting people there. And so that's why the model works, because we meet people where they are. We try to provide as much care as we can.
And they're comfortable there.
And they're comfortable there.
Yeah.
Yeah, it's like a community space. And it's so, what I love about it is it is the epitome of what health equity and SDOH is trying to accomplish from a regulatory perspective. But you are like the poster child of, and closing care gaps and meeting people where they are. And just, there's so much about it. And so, it really is the epitome of what so many people are trying to create that's not authentic. It's not culturally relevant, right? And I think it's fantastic.
Thank you.
I don't think we even really need to ask him the question, because we already know the answer.
Well, we'll ask him if he wants to add anything, because
Go ahead.
it wouldn't be fair. So we are asking everybody that comes on to this on the road edition, and on the podcast too, we do this, is what do you think, what are you passionate about that you think could make a real change, all caps, REAL, in healthcare?
The reason I started Oben is because, and I shared this story with you as well, was a few years ago, my brother passed away from uncontrolled hypertension at age 36, went to bed and he didn't wake up. And I remember that moment, even telling the story still gives me, I still shiver, and I'm still like, feels real. And it's how can someone so young pass away from something that's so preventable? And that's haunted me. And I think the reason why it's haunted me is because he didn't die of a lack of newer technology or a medical device. That's not the reason why. It's because we didn't get the basics right. It's because he didn't get screened. And I have that every day. I think I've written that down as, if he had gotten screened, I think he'd still be here. And when people are like, what do you think can make healthcare change? I think we really need to get the basics right. I think that's where technology can really shine. Like, sure enough, I love all the new things we're doing and the new devices
all
and
the
AI
shiny
healthcare,
objects.
all the shiny objects. It's true. And I was at a talk, and this one lady was saying we need to get the basics right. And what are those? It's access to care, screening, health literacy. Like, we really do.
I know.
And I think that's where technology can.
And
really
then you
shine.
walk in the hall, and all the shiny objects have all the shiny objects that they're handing out, and I know that a lot of that is saving lives too.
Yep.
But I think equally improving operations, improving workflows, improving how we deliver care and site of care, right?
Exactly.
Which is what you're addressing, and then addressing community needs. And I just, yay! I'm so proud of what you're doing.
It's an incredible story. And
it really is.
Such a passion mission.
So I'm really glad that you were here.
What was your brother's name?
Oben, company's name.
Yeah,
I just got chills.
Yeah. I know. This was super powerful, man. I appreciate it.
Thank you so
really
much.
appreciate you.
Thank
yeah.
you so much.